Now let us begin with ocular infections. Ocular infections encompass a variety of infections that affect other parts of the eye. Other parts of the eye in the sense conjunctiva, cornea, uvea, retina, eyelids, lacrimal gland and orbit. They may be caused by the basic four types of organisms: bacteria, fungi, virus or parasites. Now we will start with ocular bacterial infections. Bacterial infections are some of the most common ocular infections, including conjunctivitis, keratitis, uveitis, endophthalmitis, and infections of the eyelids and lacrimal glands. Now, here we are describing only conjunctivitis. Conjunctivitis means inflammation of the conjunctiva. Anything ending with itis is inflammation, and the starting word denotes which part of the body, which part of the eye it is. Now, the types of bacterial conjunctivitis include acute, chronic, hyperacute, chlamydial, and granulomatous. Acute bacterial conjunctivitis is the most common one here, and hyperacute one occurs really rare. And now acute, but hyperacute bacterial conjunctivitis, though it is rare, it is too bad, like too bad. Acute bacterial conjunctivitis, we will start from here now. The causative organisms are Staph aureus, Streptococcus pneumoniae, Haemophilus influenzae, Moraxella lacunata, Neisseria gonorrhoeae, and Corynebacterium diphtheria. The symptoms are bilateral mucopurulent discharge, redness, mild photophobia, discomfort, and eyelid adhesion. The diagnosis includes the conjunctival swabs, gram staining, and culture. The conjunctival swabs are usually taken out by dipping the swab in sterile saline, so that the conjunctival swab, when it touches the eye, it does not being like too dry and all, and it helps in taking the swab properly. And the treatment includes broad spectrum topical antibiotics and saline irrigation. uh, Here saline irrigation helps in clearing out the conjunctival sac, because it might be filled with deleterious materials, so it can be removed by using the saline irrigation. Chronic bacterial conjunctivitis may be caused by Staph aureus, Proteus mirabilis, Klebsiella, and E. coli. Everything includes Staph aureus. Why is that so? Staph aureus is included mainly because Staph aureus is the most widely available commensal present in the surface of the skin. So it might be easily getting lodged into our eyes while we are rubbing or something, and it can easily cause diseases. And symptoms include mild and long lasting conjunctival inflammation, often with irritants. The diagnosis is not specific here. It can be the general above diagnosis used. The treatment includes antibiotics if needed. Hyperacute bacterial conjunctivitis is caused by Neisseria gonorrhoeae. The Neisseria gonorrhoeae is present in the the Neisseria gonorrhoeae is present in the lower genitourinary tract of females, and when the child is getting delivered, the the organisms, the Neisseria gonorrhoeae present in the vaginal wall, may get stuck to the conjunctiva of the child, leading to conjunctivitis. The symptoms include purulent discharge, rapid progression, and corneal ulcer risks, because it is easily invading organism. And the purulent discharge during night, it may lead to sticking of the eyelids together. The treatment includes systemic antibiotics and frequent topical antibiotics. Chlamydial conjunctivitis is caused by Chlamydia trachomatis. It causes, the symptoms will be follicular conjunctivitis called as trachoma, follicles, and conjunctival erythema, which is caused by inclusion. The trachoma is caused by types of serovars, the zero things A to C, and inclusions are caused by D to K. The diagnosis is done by serological tests and PCR. The treatment is by topical tetracycline or erythromycin and systemic azithromycin. Granulomatous bacterial conjunctivitis is associated with tuberculosis, syphilis, and leprosy. Diagnosis is done by staining. Usually, the tuberculosis and leprosy organisms are done by using acid-fast staining, and PCR is another diagnosis method. Treatment is by specific antibiotics. Now we are getting into bacterial ocular infections. Bacterial keratitis. Bacterial keratitis is caused by Staph aureus, Pseudomonas, Streptococcus pneumoniae, and the diagnosis is by corneal scrapings, gram stain, and cultures on blood and meconchia agar. Treatment is done by combination therapy with cefazolin plus tobramycin eye drops. Tobramycin is more commonly used in eye infections. Bacterial uveitis, often granulomatous, including Mycobacterium tuberculosis and Treponema pallidum. Diagnosis is by direct microscopy and PCR. The treatment is with appropriate systemic antibiotics. Endophthalmitis, commonly caused by Staph epidermidis and Staph aureus. It involves vitreous and aqueous sample cultures because there is purulent inflammation of the aqueous humor and the vitreous humor here. And the treatment includes intravitreal antibiotics, vancomycin plus ceftazidime, and with steroid therapy. Blepharitis, it is primarily caused by Staph aureus, and it is the inflammation of the eyelids. It involves lid hygiene, warm compresses, and topical antibiotics. Dacrocystitis is the acute and chronic, both commonly involving Streptococcus pyogenes and Staph aureus. And here, antibiotics and drainage of abscess if it is present. Orbital cellulitis is caused by Staph aureus, Streptococcus pyogenes, and pneumococcus, and it is caused by culture of the aspirated samples. IV antibiotics is given, and if necessary, surgical intervention is provided. Now let us get into ocular viral infections. It includes it can affect conjunctiva, cornea, uvea, and retina, with common types including keratoconjunctivitis, uveitis, and retinitis. Viral ocular infections are caused by herpes zoster ophthalmicus, adenoviral conjunctivitis. Here, herpes is caused by HSV1. It is most commonly HSV1 because HSV1 affects the body parts above the waist or above the umbilicus, and below it is caused more commonly by HSV2. The diagnosis is by direct fluorescence antibody testing, DFAT, and a PCR. The treatment is by topical antivirals such as acyclovir and debridement for recurring cases. Zoster ophthalmicus, it is caused by varicella zoster virus. The diagnosis is by clinical presentation and by the PCR, and the treatment is systemic antivirals, acyclovir. Adenoviral conjunctivitis is caused by adenovirus serotypes 3, 7, 8, 19, and 37. The diagnosis is by PCR and antigen detection tests. The treatment is supportive with frequent hand washing to prevent the spread. Cytomegalovirus retinitis is caused by cytomegalovirus. The diagnosis is by PCR for its DNA, and the treatment is with ganciclovir or foscarnet. Acute hemorrhagic conjunctivitis, it is caused by enterovirus 17, Coxsackie virus A24. The diagnosis is by clinical examination and PCR, and the treatment is symptomatic. Ocular parasitic infections in the eye are rare but can cause severe complications. Acanthamoeba keratitis, it is caused by Acanthamoeba species associated with contact lens. So guys who are using contact lenses, please take care because it is more common with contact lens usage. Laboratory diagnosis is by wet mount of corneal scraping. It shows trophozoites, and PCR for the speciation, and the treatment is by topical antiseptics, propamidine and chlorhexidine. Ocular toxoplasmosis caused by Toxoplasma gondii. It is the laboratory diagnosis is done by serology for IgG antibodies and PCR on ocular fluid. The treatment is by pyrimethamine, sulfadiazine, and prednisone. Ocular onchocerciasis, it is caused by Onchocerca volvulus. The laboratory diagnosis is by slit lamp examination to visualize the microfilariae, and the treatment is by ivermectin. Now, ocular fungal infections, it is the last one for here. Fungal infection is caused by trauma or a prolonged use of antibiotics or steroids, because prolonged use of steroids may lead to immunosuppression, and when there is immunosuppression, easily these fungal infections can occur in the body. So the types are mycotic keratitis, it is caused by Aspergillus, Candida, and Fusarium. The laboratory diagnosis, it is commonly done by KH wet mount. KOH wet mount is done because the potassium hydroxide, it is helpful in degrading the keratin. The keratin which is present usually in these dead cells, the keratin will be dissolved, and it helps to clearly identify or look into the morphology of these fungi. And the culture usually for any fungus, it is done on Sabrodextrose agar, and treatment is using topical antifungals like natamycin or amphotericin B. Amphotericin B is more toxic, and hence when it is given systemically, here it is given topically, but when it is given systemically, to prevent the next nephrotoxicity, we give liposomal amphotericin B, which is more target oriented since it is traveling inside liposomes. Now, orbital mucormycosis, it is caused by Mucor and Rhizopus species. The laboratory diagnosis and the biopsy shows broad non-septate hyphae, and the treatment includes surgical debridement and IV amphotericin B. And in IV amphotericin B, as I had already said, better use is of by giving a liposomal amphotericin B. Now, presumed ocular histoplasmosis syndrome, it is caused by Histoplasma capsulatum. The laboratory diagnosis is by positive histoplasmin skin test, and the treatment is by antifungal agents in severe cases. Ocular candidiasis, it is caused by Candida albicans, and in laboratory diagnosis it shows vitreous aspirate showing yeast cells, and the treatment is by amphotericin B or fluconazole. With this, the ocular infections gets over. Thank you.